When you hear the word fiber, what comes to mind? For most people, it's trips to the bathroom or perhaps tasteless bran muffins. But here's a surprise nobody really talks about for fiber. Fiber can actually lower your blood pressure. Not a gimmick, not a miracle cure, but in a slow, steady, research-backed way. And the effect? Even bigger if you've already been diagnosed with high blood pressure. Hi, I'm Dr. Brian. I help people cut through all the noise and health advice so you can focus on what actually makes a difference. And today, I want to take fiber out of the boring food box because it deserves more credit than it gets. Yes, it's the stuff you've always associated with digestion, but it turns out it's also great for your blood pressure. By the end of this video, you're going to know, number one, why fiber matters for blood pressure. Number two, how much do you really need and how much can it really help? And number three, how to add it to your day without dealing with some very unpleasant GI side effects. Hi, I'm Dr. Brian. Now, high blood pressure or hypertension is one of the most common, dangerous, and silent health issues that all of us face. And we talk a lot about cutting sodium, exercising, losing weight, and those are important. But hardly anyone talks about fiber for blood pressure, and that's a big oversight because when researchers looked at fiber all by itself, not bundled with diet overhauls or lifestyle changes, they found real blood pressure benefits. On average, systolic pressure dropped by 3 to 6 points. Diastolic, the bottom number, by 2 to 4 points. You might think, that's not much. But remember, population data shows even a 2-point drop in systolic blood pressure translates into about a 10% reduction in stroke deaths. So if you're already at higher risk and you already have hypertension, the benefits are even stronger. All right, so let's dig into the science. Researchers love something called a meta-analysis. That's when they pull together data from multiple studies to try and get the clearest, best possible answer. One meta-analysis looking at fiber published in 2022 showed that fiber alone lowered blood pressure by about 4 points on the top number, systolic, and 3 on the bottom, diastolic. Now another study, similar but a few years prior, showed nearly 6 and 4 points drop. And the most striking part, the people with high blood pressure going in got the biggest payoff. Just to be clear, this isn't about replacing your medication with oatmeal, but it is about adding something safe, cheap, and simple that nudges your numbers in the right direction. Now keep in mind, not all fiber is created equal, because this is where it gets kind of interesting. Not all fiber is the same. There's insoluble fiber, that's the roughage from veggies, whole grains. It's great for digestion, and it's mostly what you hear about. It sweeps your intestines like a broom. But for blood pressure, it's not the star. The real winner is soluble, viscous fiber. Think psyllium husk, like the stuff in Metamucil, or what you get by eating oats and barley. That's called beta-glucan. These fibers, this insoluble fiber, forms a gel in your gut. That gel feeds your good gut bacteria, and that together triggers changes that help your blood vessels relax and help your kidneys get better at flushing out sodium. So how much fiber do you need? The sweet spot in research is about 8 to 15 grams of soluble fiber a day. Going up to 20 grams seems to give the maximum benefit. To put that in perspective, 1 rounded tablespoon of psyllium husk, Metamucil, has about 6 to 7 grams. So 2 to 3 servings a day gets you right where you want to be. Below that, you still get some benefit. Above that, though, your intestines might start filing complaint forms. Speaking of complaints, here's where most people go wrong. They hear information like this: fiber lowers blood pressure. They run to the store, they start pounding down tablespoons of psyllium, and then they regret it. The secret is to go slow. Add just a few grams a week. Drink plenty of water. Think of it like introducing a new roommate to your gut bacteria. You don't want chaos, you want peace. If you're using psyllium, stir it into water or a smoothie and drink it quickly before it gels. And if you'd rather use food, oatmeal, barley, beans, lentils. Eventually your gut will adapt, and so will your blood pressure. But let's keep it in perspective because we want expectations to be realistic. Fiber won't lower your blood pressure as much as cutting sodium, losing 20 pounds, or following the DASH diet. But that's not the point. The point is, it's another tool. And when you stack it on top of the big hitters, exercise, diet, medications for some, those small wins add up. And in blood pressure control, the sum really is greater than the parts. So here's the takeaway. Fiber, not sexy, also not expensive. And yes, it's great for digestion, but it's also a legitimate, evidence-backed way to shave points off your blood pressure. So tomorrow morning, maybe it's not just coffee. Maybe it's coffee plus a bowl of oatmeal, or a quick psyllium shake or smoothie. Your gut and your arteries will thank you. That's fiber. If you want more science-based health information explained simply without the hype, you're in the right place. I'm Dr. Brian. Thanks for watching, and I'll see you in the next video.